past 4 decades, the number of obese children and adolescents has more than doubled, and about 15% of all children are now overweight. Due to its increasing prevalence in American society, the adverse effects of obesity on those people affected by it are becoming more and more visible. Childhood obesity has been proven to lead to health and social problems lasting well into adulthood. For this reason, we must pay closer attention to the causes of childhood obesity and take preventative measures to keep it from affecting the health of children for generations to come. The genetic causes of obesity are owed to a complex interaction between numerous related genes. Some experts also theorize that over or undernutrition in the prenatal environment can later lead to obesity during childhood. 2 more contributors to obesity in children are poor diet and inactivity. Studies have shown that the metabolic rate is lower when watching television than when simply resting. Children also often seem to passively consume excessive amounts of energy-dense food while watching television, and television advertising is often focused on high-calorie, non-nutritious foods. Therefore, when children watch television for excessive amounts of time, as is increasingly the case today, they are at higher risk for obesity. In children, obesity can lead to hypertension, chronic inflammation, increased blood clotting tendency, and other pulmonary and cardiovascular issues. Type 2 diabetes among adolescents now accounts for as many as half of all new diagnoses of diabetes in some populations, whereas the obesity and lifestyle-linked disease was once virtually exclusive to adults. Rampant discrimination against overweight people is considered acceptable in society as it stands today. Obesity is considered to be a result of gluttony and lack of self-control, and not a serious medical condition. Children will often ostracize their obese classmates, which can lower self-esteem and inhibit social skills and the development of relationships with peers. Studies indicate that when obese children experience lower self-esteem, they also feel increased sadness, loneliness, and nervousness. A study of females who were overweight at adolescence showed that 7 years later they experienced lower rates of marriage, fewer years of education completed, lower family incomes, and higher rates of poverty when compared to their average weight peers. In conclusion, childhood obesity should be treated as any widespread health crisis. Public institutions, particularly schools, should be equipped with the resources to help both prevent and alleviate the numerous damages caused by childhood obesity.